Right.
Well, today we have with us Dr. Shivaji Basu, and he's practicing in Kolkata. Today we're going to be talking about kidney stone management. Sir, very welcome.
Thank you.
So the very first question I would like to ask you, why you think the cases of kidney stones are on a high rise these days?
Well, it's a first life, first of all, and people they forget taking a lot of fluids while they're at work and running around. That's number one. And number two, bad food habits, the fast food and the fizzy drinks, and then on top of that, less drinking. These are that reason for which stones are on rise. Well, on that same note, I would say they are more diagnosed a bit more than it was 20 years back, because of the modalities of treatment of ultrasound. Half a chance they will go to a doctor and even get an ultrasound done by themselves. But true, it is on the rise, but it's a lifestyle which is responsible, I would say.
Well, what could be the actually the problems or the complications, if because we live in a country where a patient goes to the doctor when it's over the head? Yeah?
Absolutely.
So what could be the complication if a person is ignoring the stone and he goes to the later stage of the stone to a doctor? What could be the complications?
Well,
you might face?
what happens, surprisingly, the patients after a few attacks of colics, they ignore.
Yeah.
And when they think their colic has stopped, they think they have passed the stone. Actually, on the contrary, when the colic has stopped, the kidney starts suffering. Because while your kidney is alive and well, it will try and drive the stone out. But when it is tired, fatigued, it will just stay silent,
Yes.
and that's the time it starts getting damaged. And after a while, there will be no point of no return. You may have to sacrifice the kidney. So, fortunately, more days ago, people are getting the awareness program. After one or at the most two colics, they go to the doctor, and a simple ultrasound, you get it in the urban, in the the villages, the ultrasound is available. So that simple ultrasound will tell you whether you have got a stone or not, and that's the time. I mean, you will not get a second chance. Mm-hmm. Next is the kidney gets damaged.
Well, very truly said, actually. So, and in the same genre, I would like to ask you, when the surgical intervention it becomes very necessary, and are there any possibilities that we can avoid the surgical interventions?
Again, the same thing is that
Depends on the time.
yes, because surgical intervention includes everything.
Yeah.
And not the open surgery, it's just like that. Even if you do a PCNL, if you do a laser lithotripsy, these are all surgical intervention. Maybe ESW is the minimally invasive that way. But if your stones are picked up in a very early stage, either you can take medicines and then take the stone, drive the stone out, or even if you need a very minor surgery, you can do it. But when the stone gets bigger, then the medicine doesn't work. Medicine only helps in keeping the kidney healthy, but it will not drive the stone out. Surgery will be necessary in whatever form.
Well, when we are talking about the kidney stones, we have ever heard the misconceptions or the myths. There might be patients who comes to you with some myths or the misconception about the kidney stone. For example, if somebody told me that if I drink this, the stone might get passed out. So, would you like to break any of those myths or misconceptions of patients?
Well, I wouldn't say the misconception that way. Truly, there are about if it's come to the ureter, and 10 to 15% of the stones of a smaller size, it will pass by itself by simple drinking, but more often medicines like tamsukin sort of thing, it will drive the stone out. But so this is the part of the misconception. Is a large stone, if you think it will come out by itself, that's a misconception. But if you are picked up, your stones are picked up in an early stage, then true, I wait for one month or 6 weeks for them to get the stone out
But
by
if it is
itself.
not happening in 1 month or 2 months, for example, then are there still possibility to wait? I mean, should we wait or should we?
Depends on the sonographic finding.
Okay.
If the sonograph shows a dilatation of the kidney is suffering, then I wouldn't wait. So it's a misconception for the doctors as well, that a small stone, if you're left with 3 months, the kidney will get damaged. No. If the ultrasonogram shows reasonably healthy kidney, little bit of dilatation, you can jolly well wait for 3 months, provided the patient is not suffering and provided the kidney is not suffering. But really the message to all the patients is that you don't take the decision. Let the doctor take the decision.
Yes.
Whether there's a good possibility for you to pass the stone, and if not, when the kidney will start getting damaged. Before that, everything should be over.
Well, that was very amazing and all the information was very fruitful. Thank you so much for being here. We're very glad to have you.
Thank you.
Thank you.